Good afternoon. I'm Sudha Acharya. I'm the Executive Director of South Asian Council for Social Services, or SACSS. We're in Flushing, New York, Flushing, Queens. We are proud and honored to partner with Honorable Council Member Peter Koo, who is Council Member of our district, right, to have this webinar. We are partnering with them and hosting this. South Asian Council for Social Services is 21 years old this year, and we started SACS to empower South Asian and other immigrants and help them integrate into the economic and civic life of New York. This last past 15 months, COVID-19 or the pandemic has played havoc with the lives of our communities. People have lost family members, friends. People have lost their jobs, and with their jobs, they've lost their health insurance. And it's been hard for them to put, food on the table or pay rent. And it's been extremely difficult. And there are quite a number of them were isolated and really getting depressed. So with jobs, they lost health insurance. And what SACS has been doing in the past 15 months is helping them connect to health insurance and other benefits, and helping them with supportive counseling, group counseling, and most of all, helping them with food. So we have the first South Asian pantry, which serves 4,800 to 5,000 people per week. We have a curbside pantry where about 920 people lined up yesterday. It's on Wednesdays to receive food, and we deliver food to people who cannot come to us. And also help, hot meals are served as well. Now, one of the most difficult thing during this pandemic is the type of emotional toll this pandemic has taken on the lives of our people. It's just not enough that they have to struggle for their livelihood, struggle for everything, and the loss of people is there. But now what is happening is their loved ones, their families back home from their countries of origin are suffering. So this has created an extremely critical condition of situation for them. And this webinar that we have today will address how to recognize symptoms of mental anguish, and how to cope with that, and what are the resources available, and so on. Please note that all the information that you need is in the chat. Please look at the chat, okay? And we request that all of you mute yourselves. And if you have any questions or comments, please put them in the chat, and they will be addressed by the moderator and the panelists that we have. We have an excellent panel today. I would now, I have a great honor in, requesting, Council Member Peter Koo to address us. Thank you.
Thank you, Suha. Thank you, South Asian Council for Social Services. Welcome everyone to this mental health panel on COVID-19 in South Asia. And welcome to everyone who tuned in. I hope we will all learn something today that will help us deal with these difficult times. To some extent, so many communities are going through or having gone through an extremely difficult time due to the spread of COVID-19 in their countries of birth. The anxiety, the fear, the feeling of helplessness, we are all going through this together as we think of our loved ones. So many of us in Queens have families and friends overseas. And while we are finally starting to recover, countries like India and others are in the middle of a crisis. The COVID-19 pandemic has presented us with some of the most trying times of our generation. Meanwhile, our own city is experiencing a mental health crisis. If we are to beat this pandemic around the world, we need to spend more resources on the mental health of ourselves and our fellow New Yorkers. That starts simple. With conversations like this one, a place where we can share our experiences, our grief, and our coping mechanisms during the time of unprecedented hardship. Thank you to all our panelists, and thank you to everyone who tunes in. I hope you take away some comfort and optimism from this effort. Thank you, SACSS, and thank you, Suha, again. Thank you.
Thank you, Council Member.
Thank you. Hello, everyone. My name is Dr. Ranu Bopana. I'm a physician and a psychiatrist. I have been involved with SACSS almost from its founding and currently a board member. So honored to be here today. Thank you to SACSS for inviting me to this event. I would also like to introduce now my fellow panelists. We have Ms. Adiba Chowdhury, who is a senior program manager at SACSS in support services. Thank you for joining us. We have Dr. Bobby Nasser, who is has been a social work professor at Yeshiva University for 36 years. She has done a lot of work in human rights and work with refugees. She also has been involved with SACSS almost from the beginning, and we thank her for all of her work and for being here today. And we have Ms. Reshma Shah. Reshma is a clinical social worker with more than 20 years of experience. I had the pleasure of working with Reshma at the Child Center of New York, and I know what fabulous work she does. She's currently at the University Settlement. So thank you for joining us, Reshma. As you know, as the councilman has just said, you know, these are really unprecedented times. What we have gone through here in New York and in the United States really has taken a toll. And as we're finally turning the corner on the pandemic here, we're watching with anguish what's happening in South Asia. As you know, India, Nepal, Bangladesh, Sri Lanka, Pakistan are reporting such high numbers of COVID and rising death tolls. Many of us in the US and in New York have you know, family members and close friends who are there, and we're really struggling with helplessness, grief, anxiety, despair, and it's been a very traumatic time. Some are even dealing with guilt, you know, to be in a better position and to be helpless in helping people there. So let's talk a little bit today about how do we cope with these challenges? What have we been through? What are we seeing, and what help can we offer? Let me start. My first question is actually to Adiba Chowdhury. Let me start with asking you, Adiba, what are you seeing and hearing in the community? What are some of the emotional struggles and the challenges that people have been sharing with you?
Thank you, Dr. Rano. Good evening, everybody. Here in New York, things are opening up. Most of us are done with the vaccination. Weather is getting better. We're eagerly waiting outside to meet our family and friends. But on the other hand, in South Asian countries like India, Nepal, Bangladesh, Pakistan, second wave is hitting really hard. So the trauma many of our clients are going through is unbelievable because most of them are having double, loss here in New York and also in India and other countries. So the feelings are really, really mixed. Like I have a client who lost a sibling and during COVID, she had to attend the funeral through Zoom. She was so sad and feeling bad about it that she never had a chance to say goodbye to them or have a last word with them. Then I have another client. She is in her 30s, has a teenage son. So she said, I did not even know the day I called 911 ambulance, took my husband. That was the last time that I'm going to see him. I will never ever see him again. And what bothers her the most, she couldn't do the ritual and, she couldn't attend the funeral also. Then I have another group of clients who wants to be happy, they're safe and healthy. They're done with the vaccination, but in their heart and mind, they're constantly worrying about the people back home. They're thinking about them. And every time their phone rings, they're like, what's going to be the news? Is everybody okay? Am I going to hear something terrible? So the thing, the feelings are really, really mixed. Some of them are traumatized. Some of them are very, very tensed and sad. And some of them are worrying too much. I have all group of people, age group in the office, the client we deal with. But most of the time we are worried about our seniors. They're the most vulnerable one. And they have family member left. So another way, they is there became like everyday routine, thinking about the family members back home. Thank you.
Absolutely. Thank you so much, Adiba. Yeah, it's really heartbreaking and, devastating. And, one of the ways that we deal with grief is really by being together with the rest of the family, with, engaging in rituals, which are, really provide comfort and structure to that. And what this pandemic has taken away is the ability to do any of that or to say goodbye. Reshma, let me ask you, how, what are some ways that families, can find closure when, in this kind of a situation that is so unusual? How does one, process their grief in these times?
Right. Good evening, everyone. So, yeah, Dr. Bopana, I mean, this is really first of all, really acknowledging that these are very unusual circumstances, what we have seen in the pandemic. Our sense of control has actually just completely kind of gone, right? And grief resolution is actually a process that happens, something which our families also need to understand. You go through stages of grief resolution where it involves, where there might be a sense of denial initially, then there might be some level of anger, like, why did this happen to us? Some sort of bargaining where could have done this, could have done that, a feeling of sadness, definitely. And then finally comes acceptance. So I think it's most important that for our families and individuals to really understand that this is a whole process that happens, the whole, cycle of grieving, and to allow ourselves to really go through that cycle, to allow ourselves to feel those emotions. Because if we don't express those emotions, or if we don't allow ourselves to feel those emotions, they're going to manifest themselves in other ways. So the first thing is to really kind of allow ourselves to the whole grieving process, and not like just immediately switch on, switch off. That's all.
Absolutely. And Reshma, do you find that the going through those stages is linear, or are there times when things can, really ebb and flow and go backwards? And
Absolutely. I mean, the flow can definitely be backwards and forwards. So in the sense that for some of our, the families who are here, it is really a very complicated grief, right? Because you went through the wave of pandemic year last year, right? And then now when it is really hitting back in our countries, it's hitting you again. So it's definitely a very complicated grief process that you're going through. You're going through over it again. And sometimes people experience certain symptoms, as we call them, as post-traumatic stress. Okay, so stress that you experience after going through some kind of a traumatic thing. And this comes up in the form of like different symptoms, which we could see in terms of mental health. For example, behaviorally, we do see that sometimes people express that there is an increased sense of irritation, irritability, anger, certain level of maybe sometimes even like, social isolation, certain self-destructive behavior, hypervigilance, like really being very vigilant to any, dangers around. Those kind of, behavioral actions are kind of like seen. Apart from that, it can also manifest in the form of your mood, where you really start losing interest in pleasurable activities or other activities, and you start feeling like guilty or lonely. Can start also affecting our sleep, where people might express about insomnia or having nightmares, having flashbacks, and also in terms of like psychologically, where you really start feeling intense like fear, extreme anxiety. So, these are some of the different ways that, these signs and symptoms can come along. You might really not realize it, that you're going through a post-traumatic stress. It also comes along with a sense of mistrust, sometimes a certain sense of mistrust, because you're hearing a lot. And in the sense that also there is sometimes like some unwanted thoughts that you might have, that people might be going through. So all these different signs and symptoms, Dr. Bopana, are ways through which your post-traumatic stress might be coming through if the grief has not been completely resolved.
thank you, Reshma. And, I think that, to some degree, all of us have experienced, some of these symptoms during these unusual times. This pandemic has really, upended all of our routines. And, there has been a sense of, of lack of control. And, we have all been hypervigilant, trying to keep everyone safe. How do you know, that what you're experiencing goes beyond, sort of, normal situational things that you may experience going through something like this, and when it's really crossed over into something, where you should maybe pay a little more attention or get even outside help? Rishma, if you wouldn't mind.
Yeah.
Taking.
So definitely, Dr. Bopana, I mean, if you, as you mentioned, that's some level of all these feelings we have all gone through, and, grief process that we have all gone through. But definitely, if your thoughts are getting into like any self-destructive thoughts, or you're feeling extremely depressed, so much so that you're really not able to motivate yourself to do something, or like you're really having a lot of sleep disorder going on, and it's affecting like your functioning at your work level, at your family level to a large extent, and you're really not able to get out of it, then those are really signs that there is much more trauma in there, and you should probably, going out to seek some help for it, get some counseling, or start talking, to a therapist and get some help for it. Definitely.
Absolutely. And with mental health, just like any other health, it's a lot easier to treat when the problem is small, right? So when you have a small, infection, it's much easier to treat than when it takes over everything and causes other secondary problems. And so just like with health, it's much easier in mental health to take care of the problem.
Hello, hi. Ranu, I think you're muted. Okay.
Okay, sorry about that. Can everyone hear me? I was just saying that it's I don't know how much of it you heard, that it's much easier to get help early on. And with mental health, for some reason we just associate it more with stigma. We think that it is some kind of a character flaw, that if we were we should be able to help ourselves. But just like with health, we sometimes really do need to turn to professionals or to outside help to nip that problem in the bud early on. So my next question. I'm sorry, I think we have, I don't know.
We'll take care of it. Right, okay. Done.
Okay, thank you. The problems with Zoom. Okay, so my next question, Bobby, is for you. Yes. So, as we've already talked about, many people are experiencing these things. And, if you do find yourself, maybe being hypervigilant, scouring the news or social media for constant updates, or you're feeling anxious, or you're having some trouble sleeping, what do you recommend people do in terms of self-care, and why is that important?
Thank you very much for excellent question. I think the first thing is to encourage people to communicate with people they're close to and to talk about what they're experiencing. And I always like to use the concept of stress as opposed to bombing. Okay, anyway, I always like to encourage people to talk more in terms of stress, because I think we all know what it is to experience stress, and I think it has a little less stigma to it. So I use that term quite a bit. And then I think that I would start with this whole idea of encouraging people to talk to friends and people they trust about what they're experiencing, and to pay attention. I think we all are pretty familiar with this, but to really pay attention to how they're doing in terms of sleep. I always like to start with sleep, because sleep is extremely restorative for all of us. We know that if we get a good night's sleep, that we start to feel better, and it has this restorative function. The next thing I like to do is really encourage people to make sure they have structure to the day. And what I mean by this is that they make sure, let's say we were already talking, Reshma was already talking about this whole idea of people that might be really depressed, frankly, and anxious, and they're just not doing much. And the whole cycle, the vicious cycle of not doing much is that the more you stay away from people, the more you, the common concept is hiding under the covers, the worse it gets. So having a structure to the day, I think, is very good. And even if it's a sort of small goal each day, to make sure that they leave the house each day, to make sure that they have contact with somebody each day, and preferably to have some good old-fashioned exercise. It could be just walking somewhere. And I think the structure is very, very helpful. And then there's this sorting through that we've all had to do now for what, 15, going on 16 months. We've all had to sort out how much control we actually have over our situations, right? So it's been very stressful. I mean, I think we could all say, I can say for myself, very stressful period of time this whole last 14, 15 months, because constantly I've been having to figure out what's safe, what's not safe, what can I do in terms of seeing people. And it's very painful. The process is very painful, and you start getting scared of people. So where you get comfort, we're all used to getting comfort from our friends and family, and now all this time we've been scared of other people. And sometimes it can be people that you really miss and really want to be close to. But because of this possibility of becoming infected, we've started thinking of so many people as people to be scared of. So I think it's this whole thing of sorting through on a daily basis, how you're taking care of yourself, if you're getting enough sleep, how you're doing in terms of making sure that your food is okay, healthy food, and that you're getting exercise. And again, I would say structure is extremely important. And making it, I think what I want to communicate to everybody, and I'll start with communicating to myself, we're having normal reactions to difficult situations. This is what it is. There's nothing more to it than that. Our reactions are completely, in that sense, healthy. You know, we've been going through deprivation, we've been missing people, we've been, and also the additional trauma that we've just been talking about people literally dying, and then not being able to come together with other people when this happens. So that's my general thought about self-care. Okay.
Thank you, and especially such a good comment about sleep. It's very, very hard to get better if you're not sleeping well. And again, sorry for the Zoom bummers. Hopefully that won't be happening. Yeah, and so let's talk a little bit now about survivor's guilt. So, just as we're thinking that, there's maybe a light at the end of this tunnel and things are going to get better. We're thinking about piecing together our lives again and getting out into the world. There's been this horrific, crisis in South Asia, and it was in the news constantly, and just incredibly difficult to look at, and so sad what's happening. And everyone that has ties to South Asia knows somebody personally who is lost or has passed away, or has been affected by this. And it's almost been a little more painful now that it's not in the news all the time. Because if you're very connected with South Asia, you know what the situation is and how bad it is, and it's a crisis every day, and yet here we are, carrying on and getting back to life as usual, and the general public may not even realize that this is still very much of a crisis and continuing to unfold. So many people feel very guilty about that they're healthy and they're comfortable, that they made it through a tough time, that they're vaccinated, and they can maybe sometimes feel very helpless that they're not able to do more for those family members or friends back home. Others may feel guilty that they're not able to look after their children because they're so preoccupied with the crisis back in South Asia and what family members are going through there. What do you, let me ask Reshma, and then Bobby, I'll ask you if you want to chime in as well. Reshma, what do you, what do you think about this? What can people do if they're finding that they're, going through a lot of guilt and shame?
Yeah, that's really, Dr. Bopana, a very, very important issue. So first of all, to really understand like survivor's guilt is basically, yeah, like really people who think that there is like something wrong with them because they survived through a traumatic process, traumatic event, where others did not, right? And you already mentioned some of the reasons why someone might be feeling that, mainly because they have been healthy and comfortable, where especially like in South Asia, like in India, where others have not been comfortable, or even though you made all the attempts to help save your loved ones, you could not, and you survived, and you lost out on them. You might, someone might even feel guilty because they were not able to attend the last rites with the family, which we know is like culturally very important for all of us, because of the distance. We are there, you're here, that kind of thing. Or even though like you're here, but really, you're so preoccupied with everything that has been happening there, that a parent, for example, can feel guilty that they have been neglecting their children here. They have really not been able to give them that much of time and attention because they're so much preoccupied, and with the difference in the time zones and all that, like sometimes you're awake the whole night because you're really trying to find out about what's happening out there, right? And so you're not able to be as much like productive, or really a lot of your family responsibilities might be falling on your other family members, and so you might be feeling guilty even because of that, you're really not, you're not pulling through a lot of things in here. So this guilt, I mean, is something that, yes, when we experience it to a certain extent, it does propel us into some action whereby things like you might get yourself like vaccinated. You might make sure that other family members and your friends are okay, and also to the fact that you will help out in whatever way in your community or any of your friends who are really going through a similar kind of a process, and really be empathetic to them. But when this guilt kind of like becomes a little bit too much intense, and you're really not able to resolve it, and that's when it can kind of like start getting a little problematic, because it starts stressing you out. This guilt will start getting heavy and it will start stressing you out. And then what it does is that it's going to affect our immune system. And we will see it that it comes out in forms of certain somatic complaints, or we start experiencing like depression, anxiety, all those feelings, they start coming in because of this, the whole burden of this guilt. So as you rightly said, that how do we deal with this guilt now, right? Okay. So some of the ways that we can really deal with this guilt, first of all, is like acknowledge, accept the feeling. Okay, so instead of, which is the most important thing with any feeling, right? Like accepting it. Okay, this is what I'm feeling, this is what I'm going through, So really accepting that feeling, and then stop the negative self-talk that you might be having. Okay, so like, giving yourself statements like, I'm a bad son, or I'm a bad daughter, or I did not do this thing, or whatever. Stop that negative self-talk, right? Accept the share of the responsibility, accept your share of the responsibility, whatever you can do to the best, So whatever in your family participation that you could do to the extent, yes, do that. Even in the community wise, if you feel like helping the community in some way makes you feel definitely better, just do that. Okay, so put in your efforts into that. Most important is like, before we be compassionate to someone else, we have to practice self-compassion. So being compassionate to ourselves, being gentle to ourselves, that, as I said even before, like these are unusual circumstances. So accept that and you know, like, and acknowledge it that, okay, this is the best that I could do under these circumstances, and that's the best that I have done. So really being self-compassionate, because only when we are self-compassionate will we also compassionate to our other family members and friends. Mindfulness, which is really focusing on here and now, trying to keep that focus onto here and now instead of, you know, shifting into the past or shifting into the future. So like really be into the present, so that, you know, you're kind of like your depression, you know, when we go into the past is when we tend to feel depressed. When we go into the future is when we tend to feel anxious. But when we are in the present, it really helps us to focus. So really trying to practice that mindfulness and remaining in the present. And, you know, block the triggers. Sometimes maybe, yeah, things like, you know, some things which are really said in the media, which are really going to make you all the more like, you know, anxious or something. It might be that you need to block some triggers for that. And still after that also, if you feel that, no, I'm still going through intense guilt and it's kind of like really burdening me down, it might be really time to maybe talk to a counselor, a therapist. You know, Dr. Bopana, you already mentioned that in our culture, it is a little bit shameful, you know, to kind of like seek out help for counseling. And we tend to think that, oh, you really have to be going like crazy, you know, if you need to get any mental health kind of like help. But that's not true. Even like, you know, brief counseling, just for, you know, this kind of bereavement counseling, grief counseling you need, or helping with your guilt, or, you know, a lot of our clients that we're seeing right now, adjustment disorder with anxiety, because of this whole coping with COVID and the grief associated with it that they are going through. And so it might be time that, you know, you want to really seek out some help and talk to a counselor, therapist, and get some help for it.
Thank you. Yes, absolutely. You know, there's a reason on the airplane they say, you know, put on your own oxygen mask before you help, you know, anybody else. Because if you're not well, right, and you don't have oxygen, you can't help anybody else. So, you know, I think that that's absolutely, you know, true, and goes to, you know, your point of self-compassion and self-care. Bobby, did you want to add anything?
I think that everything that you said, Rashma, was excellent. I just want to add a couple small things. One is that there's this simple technique that's called breathing, breathing slowly, and it's amazingly effective. So when somebody's going through stress and they're finding they're having a lot of trouble relaxing or being mindful, the simple technique of breathing in to the count of 5 and breathing out to the count of 5 can make a big difference. So I wanted just to throw that out. And I think finding a quiet, peaceful place when you're in the middle of everything and you know you're becoming overwhelmed, if you can find that place, it could be outside of where you live, or it could be a space within where you live that's just a little more quiet, a little less frantic. And this is going to sound a little funny, but lots of times it helps if you straighten up your place. Because when you're surrounded by chaos and mess, it actually increases the stress level. So these are just a couple of practical things that I think help with self-care. When it comes to when it's a good time to seek help, I'm going to say again, I'm going to go back to the whole idea of sleep. If you find that you're having a great deal of trouble sleeping, it's usually a sign that it would be good for you to get some professional help. And if it's in the form, it doesn't necessarily have to be a mental health professional, but somebody that's going to help you take some mild medication so that you get back on track with sleep is very important. So I'm gonna. I mean, of course, I'm a big advocate of professional mental health people, but I'm just saying if for some reason that's becomes a challenge, this is also a reasonable step to take. Yes.
Thank you, Bobby. Yeah, absolutely. And I just want to underscore again the need for self-compassion. You know, just just remembering that we are in unprecedented times and that we have been, dealing with things coming at us that, are completely unexpected. So, we shouldn't expect that we're going to be our best selves. We're going to be unproductive some days. We're not going to be, respond in the best way sometimes. So, to just be compassionate towards yourself, recognize that there's the need to take a break, to get some help, get some things in order. I loved what you said about mindfulness. There's a lot of resources out there as well, and maybe we can, send that out later. But there's a lot of, low cost or free resources out there as well to teach you the breathing techniques, to teach you mindfulness, and that can be enormously helpful. So thanks for that.
If I could just add, I'll just put it in the chat also. There is a very nice app. It is called CBTI Coach. And that app, any one of us, we can just download it on our phone. It's absolutely free. And in that, they have very nice relaxation exercises, guided imagery exercises, which we could just all use. I'll put it in the chat for everyone. So you don't have to be like really a professional to use that. Anyone could just use that. It's a very nice app.
Yeah, thank you. Thank you, Rishma. Yes, there are a number of digital resources actually out there. So thank you for highlighting that. So Bobby, you talked a little bit about what are some of the signs that it's time to get help. You highlighted sleep very importantly. Was there anything else that you wanted to mention there?
Yes, this symptom or set of symptoms are very important. If you find that you can't calm yourself down, that your mind is racing all the time, and even though you're being advised and doing your best to avoid triggers, the triggers are coming right from inside you. So your mind is just racing. That's an important, I guess I'll call it a alarm system. That means that you really do need to seek some help. And I would say yes. And if you have friends or family, it's usually, this is more common than not. I think it's usually friends and family that realize that you've kind of going off the rails and that it's time to go. So I would say to definitely be aware that it might be okay or it might be important for you if you're a family member or a friend of somebody who's starting to behave this way and they're not eating well and they're not sleeping well, and you can see that their thinking is starting to become, I'll just call it very, very anxious, that's a good time to encourage them and maybe even be the one that goes with them to seek, to find a professional person to talk to. So I'll definitely say that, because it's hard for people to realize when they're starting to become very upset that's happening to them. So more often than not over the years, it's been actually a friend or a family member that's brought somebody in for help. So I think to say that that's fine, and maybe that's even a community education thing, that the more we can educate our different communities, that if we see somebody suffering, that it's good to bring them in for help. And we started this whole session today with Adiba talking about seniors. I can say that I've been working with people at SACSS throughout this period of time, and the seniors in particular, I've been very worried about them because they've been very isolated, and so the kind of comfort that we all get from being with people has been even more restricted for them than it has for many. So I think sometimes this is also outreach. In other words, it's not just finding it from the person themselves, but for all of us to be aware that we might need to be reaching out to people and be the one that actually encourages them and maybe actually literally goes with them to get some help. Or maybe we bring somebody to the house to get some help. we shouldn't be shy about this. This is not the time to be reserved or shy. This is the time to be proactive.
Absolutely. Thank you, Bobby. And I just wanted to make a point about, you know, acceptance, as you had mentioned, Reshma, that, you know, sometimes you might be surprised at your reaction to something. You know, it seems so, you know, out of scope to the trigger, right? And you might wonder, well, why am I experiencing this? You know, that really wasn't a very big deal. You know, other people are going through worse and they're doing okay, but why is this happening to me? Reshma, can you say something about why, you know, that might happen?
So yeah, Dr. Bopana, as like I was mentioning before, this whole switch on, switch off, really, right? You know, where we really kind of like don't get into that whole, as I said, the whole, grieving, it is a cycle and you go through those stages and you should allow yourself to go through those stages. Sometimes we just want to kind of like jump over, the stages, like just kind of like switch on, okay, and as you rightly said, that thinking that, okay, others have gone through worse than this, so I should kind of like not feel so much about what I have been through and kind of like suppress that. And that again will manifest in some form of traumatic stress. It's going to come out either in your behaviorally, or it will come out maybe in kind of like some kind of somatic complaints where you're saying, I'm having a lot of body ache, or I'm having a lot of headache. You have people like complaining, right? I'm having a lot of headache, I have been feeling very tired, I'm having a lot of backaches. Okay, because this is your body like storing in that stress because you really have not allowed yourself to accept it. Because only when you will accept it, you will work towards resolving it, right? You will work towards like going through those whole cycle. If you stop it right from the beginning, where I'm not going to accept it and I'm just going to, I'm going to be strong, which is very much in our South Asian culture, where I'm going to be strong and I'm going to continue and just go on, and you don't allow yourself, then it's going to start manifesting in these other ways. So acceptance is really the key. Acceptance, acknowledging, of allowing ourselves, yes, I do feel weak, like if you have to take like a sick day because you're really mentally not feeling well, you really need to breathe through, do that kind of a thing. So really allowing ourselves and then go through that process for it. It's very, very important.
Yeah, thank you. And one of the things that we learned, when 9/11 happened in New York, is that childhood trauma has a lot to do with how people experience stress and an experience like that. So, it wasn't necessarily the people who were the most affected by 9/11 who had the most symptoms. So, it could be that because of some childhood trauma, or maybe something that you're not even aware of, that hasn't been processed in your past, you can experience, something that's just out of alignment with what's happening. So definitely it's worth it to, investigate that and get some help if you find that. Bobby, did you want to add something?
Yes, I wanted to add that, and I'm going back to the experience we had during actually 9/11, working with different survivors. The other thing that I think we can't underestimate is the importance of people who've been through the similar circumstances coming together in a supportive way with each other. Because the whole idea that they really know what the other person or other people are experiencing, the level of support that they receive from each other is remarkable. And I think wherever we can encourage that, bringing people together, I think we should. Yes.
Great, thank you. And Adipa, can I ask you to talk a little bit about, what resources are out there if people are reaching for help?
Thanks again. Before going back to the good resource, I just want to add a point with Bobby. She mentioned about our seniors, how they are home alone, they are isolated. We have actually individual supportive counseling. We have group counseling for them. Every Monday and Thursday, we have 2 sessions for them. We also have a culturally relevant activity like Antakshari. It's for their little bit entertainment or recreation, whatever way you want to say it, because that likes reminding them their childhood, their youth, all the songs, Bollywood trivia, it's Bollywood songs. And I'm sure they enjoy it a lot because this is the only entertainment they have right now since the virtual world started during the pandemic. We strongly suggest our clients for health and mental health to talk to their physician first, because I think that comes first. From there, they can start like counseling, therapy, mindfulness meditation. They can go to the organization that helping people with the grief right now. Like us, we are doing it also, SACSS, South Asian Council for Social Services. We speak 12 South Asian languages, including Mandarin, Chinese, Cantonese, and Spanish. We have licensed social worker, and also we refer our clients to other organizations like, University Settlement, Charles B. Wang Community Health Center, Child Center of New York, Sanctuary for Families. Also, if clients need, they can visit Elmhurst and Flushing Hospital Psychiatric Department of Elmhurst and Flushing Hospitals. And if they want, they have to buy medicine. I heard it's a very, very reasonable price. I hope, we all are vaccinated and we have enough life-sustaining oxygen. Thank you.
Thank you, Adiba. And wonderful to know that people can just reach out to SACSS, to sort that out and to get referred for whatever help they may need. That's one of the wonderful things about SACSS is that it really provides, all kinds of different services. And if you have some questions, please do put them in the chat. But let me ask one question that I actually have. Bobby, you mentioned seniors as one group that has been particularly, hard hit because of the isolation. I'm wondering about children as well. This has really been so disruptive. Many of them are, quite young. This is a significant portion of their life. They've not been able to go to school or have, that interaction with their friends, have that structure of school. What are you all seeing in terms of, how kids are dealing with this and what parents are reporting to you? Whoever would like to say something about this?
Well, I'll just say just 2 quick sentences. One is that I would say I universally am hearing about children, even the ones who, let's say, are academically doing fine. This whole experience of being separated from their peers has been extremely stressful. And I'm hearing a lot about increased anxiety and just a lot of fear about what's okay to do. There's fear. There's a great deal of fear and depression. And then I think as we go up the age groups, I'd say teenagers, really awful period, terrible period, because the whole thing of being able to be a separate person, just if we think about the life cycle and the importance of being able to be your own person, and then you're stuck at home with your parents and you're not able to hang with your friends. It's been very disruptive. Yes.
Yes, Adiba, want to say something?
Yes, I want to share my personal experience with everybody. I'm raising 3 boys, their age groups are different. 6, 8, and big one just turned 13. So it was really, really hard in the beginning. And our time, there was no concept of virtual world, remote learning, nothing like that. And when they started from home, it was pressure for us, pressure for them. And I was in fear that they're gonna fall behind with the studies. But when the study, I think study-wise it's okay, but only thing bothered me, I don't like to give devices to my kids. I don't want to see them walking with the laptop or tablet or other devices and playing games all the time. But I had to compromise. I had to give them something, so they can be busy with after school, after the homework. They just cannot watch TV all the time. So what we did, we create account, they can talk to their friends, they can talk to their cousins. So they don't have to lock their room. I know what my kids are doing. They are talking to the family members, but in a group, like with their age group. Then my husband and I, we decided to have dinner together. So we can, and I also gave them some house chores to do every day. Before they didn't do all those things, but now they will be folding their clothes, cleaning their, desktop, their tables, every little thing. Whenever I'm preparing something, I call them, come and help me in the kitchen. So they don't get bored. They don't say, Mommy, I'm depressed. Mommy, I'm not feeling good. Mommy, I am bored. So I'm just constantly, whenever I'm home, trying to watch TV with them, trying to discuss the, matters, whatever happening around the world. Kids are very smart nowadays, so you cannot just keep them isolated from the fear or, whatever happening. They should know, and they should feel for people. They should feel for the family members. Whatever happening, they should know. So like talking, I think it's very important.
Thank you. Thank you, Adiba. Reshma, did you want to add something?
I just wanted to add, yes, definitely, as you're mentioning about children, Dr. Bopana, in the clinic, we are definitely seeing an increased referrals for children. In the past, like really in the past 6 months, they have gone up a lot. So, and children with not even like any traumatic history in the past or anything like that, but really experiencing a lot of anxiety and depressed mood due to all the environmental things that are going on. One of the things as the support groups for seniors is definitely very helpful, but support groups even for children is very helpful. And so in university settlement, we had like a whole grieving supports, group for children from age group of like 5 onwards, and that proved to be very helpful because sometimes we think that, children are just engrossed in watching TV or they're on their laptops or, they're with their friends, they're chatting. They're really not getting affected by what's going on in the environment. But surprisingly, they are getting affected by everything that is happening around them. And really providing them with the outlet also, like support groups or, the various other techniques that you discussed are definitely very, very important so that children can also grieve. Because if they don't, they're going to keep carrying this trauma. And then, it will kind of like adults in some other way kind of like come up. Okay.
Absolutely. Thank you for that. Children really do absorb, especially all the emotions, that they are feeling, in the house. And if they don't have the language to verbalize, what's happening or to understand, then you're absolutely right. It definitely has an impact. So very important, to keep an eye on that. And, just as you're being compassionate with yourself, to be compassionate with the children, because they really have experienced just a complete, overturning of all of their norms and, the reentry phase into society and back to school is not necessarily going to be easy for them. So to be aware of that. Great. Anything else that any of you would like to add, or are there any other questions that people have? Okay. Well, we're just about to time. So thank you all for being here and for joining us for this important conversation. Please keep in mind that SACSS is, there for you. It's a resource in the community. Please do send your friends, reach out, look out for your friends and neighbors, and please keep in touch. Thank you.
Thank you very much. Thank you, everyone.
Thank you. Thank you, Ranu.
Thank you,
And
Ron.
panel. Thank you.
Bye-bye.
Thank you. Bye.